So Dr. Rogish, let me just start. Let me just ask you a quick introduction and tell me if I'm off. You have a practice general dentist in Mentor, Ohio, correct?
You got it. So 2007 graduate from Ohio State, did a year residency at the VA hospital downtown Cleveland, and then started working in a private practice as an associate. Worked for about 10 years with a practice, and then went off on my own. Actually bought out a dentist, and that was about that was coming on 4 years ago now. So the retiring dentist had the office. So he was the second generation. So I'm the third generation, essentially, dentist at the same. It's smaller family practice, one doc.
I want to say it's about 2 or 3 years ago that I think you implemented. I think it's you have one of our 2D panos. Is that correct?
Right. I don't count 2020, so time kind of flies. But
actually that's fair.
Yep,
I think everybody wants to wipe that year off their memory on a lot of fronts.
Yeah, so it's a little bit of a blur, but yeah, looking for a panoramic X-ray unit. You kind of start to hear names a couple times, and you start to see what's popular, and you know, the pictures speak for themselves.
What were the benefits that you're getting from the system today in your practice?
It really changed the frequency with which we can take pans, and I feel good about it too. So it wasn't just taking a pan just to take it because the patients do. It's very diagnostic. You can see failing endos. You can see lesions that you typically wouldn't find on bite wing X-rays for a patient. So it changed the modality of why we take panoramic X-rays in our office. I pulled a couple that were a couple of our old images and a couple of the new Panouras, and it kind of shows you some of the details. So the changes when we came over to Imageworks and when we had the you can really see, you know, lower anteriors, they're very crisp on here. Upper anteriors, you never see that on the ScanX.
Right.
Very clear of where these wisdom teeth are. There's no doubt around here.
Yeah.
This is actually a patient who I finished up with 15 minutes ago. I said, "Oh, that's another great case. So let's pull that one in." So these are the consistent results that we get.
Yeah. We sometimes refer to it as what I call real world image quality, which is the perfect image in the perfect conditions with the perfect technique. And then you have with your staff and your busy office and what's the actual image that you're going to be seeing. And
certainly, I'm glad you brought up the technique, because that's you know, another huge benefit. After the installation, Rob reached out to me, who is very helpful as far as, you know, making sure you're using it properly. If you had questions, troubleshooting. But he sat down with us. He walked us right through it, answered questions, talked about patient positioning, and made us really think about, okay, why is this important? Right. Don't just check boxes 1, 2, and 3 and move on.
Yep.
Because that sinks in for the first couple of weeks, but then you kind of revert back to your old habits. But the training was awesome and continued. Now I can go onto the computer that's included with our Panoura and click on the link to Imageworks and get some troubleshooting right away. It's a 5-minute. Somebody will pick up and talk us right through it. It's been wonderful.
In your opinion, I mean, who would you recommend Imageworks to? What are the types of doctors that you think could take advantage of what Imageworks had to offer?
Now remind me, is the unit that we have, this Panoura, is it it's upgradable? Is that correct?
That is correct. It is upgradable to 3D. That's correct.
Okay. Yep. So yeah, you know, this is basically a good system for, I would say, a vast majority of dentists. It's priced right. It's a quality unit. The support is phenomenal. So I don't know that there's anybody that couldn't be helped with this, but really it's been bulletproof.
The other nice thing about the cone beam system is, and this is not necessarily true across the board, is it is a really strong pano. So all the advantages of the pano that you have today, all of those same advantages are baked into the cone beam as well. So and I would say a majority of the offices we work with, they're actually doing, the pano is still a really important modality for them, in addition to the cone beam.
They're primarily utilizing that though.
Right.
I have my oral surgeon that's right across the street. He's got a great cone beam, but when he sends me the panos that are taken from the cone beam, they just look atrocious. So we end up just taking a brand new pan on the patient and sending it back over if they need it. But yeah, no, it's a great product. We're super happy with it. Ladies here are like, what were we doing before? But yeah, we couldn't be happier. It works well with Aptrix, which is our imaging software that we use to pull it into the patient files. So seamless. Yeah.
Perfect. All right. Well, if you see Pete, tell him I said hi.
Oh, will do. Absolutely. Hey, nice to finally put a face with the name. And
great to meet you. And absolutely. Of course, anything else you need from us, definitely keep us posted. And once again, really appreciate your time today.
Sounds good. All right. Take care.
Have a great one. Bye.